discuss or disclose the 22nd episodes of Phatak Materia Medica live series. In this episode, we will discuss the very important remedy, a big remedy, that is alumina. So, in this episode, this is a long episode. So, stay connected, stay attended, and stay focused so that we can understand the core and essence of the alumina in different angles as given by Dr. Phatak. So, friends, have you seen the patients who is understanding everything but reacts late? Constipation, where every stool does not comes out. Old looking young girl, tired young old people, children who don't thrive. So these are the some peculiar entry points to the alumina. So according to Dr. Phatak, the alumina is deep constitutional remedy acting on cerebro-spinal axis, nervous system, mucous membrane, skin, mind and judgment. So the key idea of the alumina is disturbance of the coordination and delayed response plus dryness plus debility. So disturbance of coordination, delayed response, dryness and debility. So this remedy belongs to old people, prematurely aged patient, delicate children, sedentary women, people living artificial or mechanical lives. Alumina is the remedy of degeneration, not a inflammation. So, essence of the remedy, the central theme of the remedy is slowness of the function in every level. Slowness of the function in every level. So, mind thinks slowly, nerves conduct slowly, muscles act slowly, bowels respond slowly, and recovery is also slow. So, every pain perception is delayed. So, Dr. Phatak beautifully says that impression reach consciousness slowly. Remedy personality in simple words is that alumina patients live like this, always one step behind the life, knows what to do but cannot execute, wants to lie down but feels worse, wants to rest but rest exhaust, wants company but talking tires. So alumina patients are mentally awake but physically disconnected. So in mental and emotional totality, now disturbed reality and judgment. Disturbed reality and judgment. Phatak says that consciousness is reality, consciousness of reality is disturbed. Consciousness of reality is disturbed. Judgment is impaired. Fear of own impulses. So their own impulses are very important. Fear of knife, fear of blood, fear of losing control, fear of he may do something wrong. Illusions and altered perceptions are feels body is larger, feels numb and smooth and heavy, time passes too slowly. Mood patterns, depressive, peevish, sneering, alternating mood. They complain a lot but without energy. On awakening, very important is depressed on waking, worse in the morning and better in the evening. So alumina's morning are heavy, evening are lights. Mental slowness with hastiness. Hastiness in thinking, slow in execution, makes mistake in writing and speaking. So alumina mind is trapped between knowing and doing. So in alumina, slow response, delayed reaction, fear of own impulses, feeling unreal, depression on waking, better in evening and mental fatigue after talking. In physical general, very important is energy and vitality. So Phatak clearly mentioned that thin, inactive, wants lie down but lying increases fatigue. Premature old age, very important, old people with lack of heat or young people with premature aging as lycopodium. So in day to day OPD, we may say that see that patients with young girls with wrinkled skin at puberty, middle-aged woman behave like old lady, child who looks dull, weak and underdeveloped. So alumina ages the body faster than calendar. Alumina ages the body faster than calendar. Thermal state generally chilly, better in open air, aggravation in warm room and warm bed. They are chilly but cannot tolerate warm. So, in modalities, uh, we must remember aggravation from warm room, warm bed, morning, on waking, after menses, sitting, speaking, artificial food, potato, starch, salt, tobacco smoke, exertion, periodically alternate days, full and new moon. Emulsion is evening, open air, moderate exertion, damp weather, moderate temperature, cold washing. So warmth aggravate with chilly nature is the big clue. Patient is chilly but aggravation from warm. So constipation of alumina, we must know that, understand it correctly. So key note to the constipation, Dr. Phatak says that inactive rectum, even a soft stool passes with difficulty. Inactive rectum with soft stool passes difficultly. So this is the essence of the alumina's constipation, not by hardness alone, it is a loss of power of expulsion. So characteristic features of stool are stool may soft or hard, small balls not but still required staining, comes with pain, comes with long urging, sometimes when standing. So patient may say that, doctor, my stool is soft but doesn't come out. The sentence this alone direct us towards the alumina. So in constipation in old people, sedentary women, sucking children, artificially feed babies, people with weak nerve. So in rectal sensations, painful urging long before stool, cutting pain while passing stool, bright 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 clots of the blood, rectum is inactive. Bladder and rectum are linked, bladder muscles are paralytic, must tend to urinate, retention with dribbling, fear of bedwetting. So constipation with weak bladder, with slow nerve for the alumina. Alumina is for not hard stool but lazy rectum. Food and appetite cravings. Alumina has strong typical cravings. So craving for chalk, charcoal, dry fruit, clean white eggs, tea or tobacco, grounds, dry rice, indigestible thing. So this is a pica but with dryness and slowness. A very good remedy for pica. Aversion to potato and meat disagrees. Potato aggravates is the keynote of alumina. In children, big belly, thin limbs, poor nutrition, artificial feeding history. So alumina children are products of artificial life. They are artificially feed with artificial milk. Sleep and exhaustion, restless, anxious, confused dreams of thieves, ghost, falling, mind never fully rest, exhaustion after talking, after menses and slight exertion. So chronicity pattern, Phatak explains it as patient gets better entirely for some times and then without apparent cause it gets worse. So the waves like chronicity is important. So extreme dryness, slowness in action, constipation despite of soft stool, aggravation from warm, emulsion from open air, evening improvement, potato aggravation, artificial feeding history, exhaustion after talking. So action on nerves is the very important, that Dr. Phatak says that it affects the cerebro-spinal axis, causing disturbance in the coordination and the paratic effects. So he explains in the one sentence everything about alumina. So what this means that nerve conducts slowly, muscle response late, coordination is disturbed and power is reduced but not lost. So patient have paresis, not a paralysis. Delayed sensation is the master keynote of alumina. So pricks of the needles is felt with delay. Paresthesia, numbness, tingling, crawling sensation, heaviness, especially in the legs, heels, soles, arms. Alumina patient often says that my leg not belongs to me. Gait, walking and coordination is important. Unable to walk with closed eyes. Unable to walk with closed eyes is the keynote. So they in OPD ask patient to close eye with walk, they totters, lost balance, feels insecure. This is a sensory ataxia. Locomotor ataxia, staggering gait, fascination, small and hurried steps, feels feet are soft while walking, soles feels painful and numb. Lower limb symptoms, leg heavy, go to the sleep, numbs while sitting, cross legs, heels numb and stepping. In spine symptoms and back symptoms, back pain as if hot iron thrust through the spine, violent stitches, band-like sensation, degenerative patterns like chronic, progressive, slow worsening. Think of degenerative spine diseases, neuropathies, functional neurological disorder. Involuntary movements and spasm, very important neurological clue for the alumina. Involuntary movements of the single part, twitching, trembling, convulsive movements with tears, laughter and alternately laughs, laughs and talks between spasm. This shows that the loss of coordination between emotion and motor controls. Eye symptoms, white star before eyes, vertigo with visual disturbances, eyes go out of focus suddenly, must wait for vision to normalize, ameliorate by weeping eyes. Eyelids weak, dropping, thickened, dry, burning, suggestive of nervous weakness. In throat symptom, sensation of throat dry, full of sticks, coordination, constriction, food feels stuck, cannot swallow only small meals. So swallowing solid is painful. The function of constriction, not a stricture. So remains sore throat, constant needs to clear throat, aggravation from sticking, uvula hangs down. Think of teachers, speakers and lecturer. In skin symptoms, alumina skin is extremely dry, rough, cracked, eczema, intolerable itching in the warmth of bed. Patient scratches until it bleeds. In female, alumina is major remedy for women, especially sedentary, nervous and exhausted women, prematurely aged women. So menses has a characteristic pattern, menses too early, too short, scanty, pale, followed by great exhaustion. So in post-menstrual state, extreme weakness, mental dullness, needs entire cycle to recover. By the time she feels better, next menses arrive. So alumina women live in the permanent post-menstrual exhaustion. Leukorrhea has also characteristic, acrid, profuse, running down towards the feet, aggravation during daytime, aggravation before menses, better by cold washing, bearing down sensation, intolerable, feels organ will fall out, sexual sensation, itching, tickling and strong desire for embrace, nervous hypersensitivity plus weakness. In male, system, alumina male symptoms also nerve derived, not inflammatory. Sexual desire increased, vulvous itching, tickling in genital, but weak control, involuntary emissions during staining of the stool, followed by rectum of old symptom. Rectum bladder, these rectum, bladder and sexual organ control are paralytic. Painful erections, pain in perineum during caution, pain continues while erection is lost. In respiratory system, alumina cough is dry, nervous and irritative. Characteristics of the cough is constant, dry, hacking, interrupts breathing with sneezing. Modalities of the cough are morning on waking, talking, singing, eating irritating food, elongated vulva, uvula. Think of teachers, speakers and singers with sudden loss of voice after taking cold. In chest constricted, aggravation, sitting bent, aggravation while stooping. In heart symptom is a very characteristic of alumina, palpitation with sudden shocks, throbbing, time specific anxiety. Wakes at 4 to 5 am with anxiety at the heart, ambulation while resting. This shows that the functional cardiac anxiety, not heart disturbance. So, in the differentiation, we need to differentiate many more remedies with alumina, because alumina is a constitutional remedy and it covers a large sphere of action in different parts and organs. So, we need to differentiate between alumina with plumbum. So, mentally alumina has slowness, confusion, fear of impulses, while plumbum has mental rigidity, forceful control, anxiety about responsibility. In physical, alumina has soft stool but not power to expel. Plumbum had hard, retracted abdominal, violent colic with Leeds palsy. So, alumina is lazy in nerve, plumbum is tight nerves. Another remedy is bryonia. Because alumina and bryonia are complementary remedies, alumina is confused, slow, indecisive. Bryonia has clear mind, wants to be left alone, business minded. Alumina aggravation from warm, better in open air, while bryonia is aggravation from motion, better at absolute rest. So, bryonia avoids movement by choice, alumina avoids movement due to the weakness. Another remedy we must differentiate is silicea. Alumina is a fear of losing control, indecision. Silicea has a lack of confidence, fixed ideas, yielding nature. Alumina has soft stool with straining. Silicea stool slip back after partially expelled. So, silicea pushes but fails. Alumina cannot even push. Another remedy which is near to the alumina is calcarea carbonica. Alumina has slowness, confusion, fear of impulses. Calcarea has anxiety about health, security, future, desire for eggs. Alumina has dryness everywhere. Calcarea has profuse perspiration and fabbiness. So, calcarea accumulates, alumina dries and degenerates. Another remedy we must differentiate is sepia. So, alumina and sepia, alumina fearful, depressed, confused, while sepia is indifferent, irritable, aversion to family, desire for dancing. Alumina has weakness after menses. Sepia is bearing down better by crossing legs, better by exercises. So, sepia has hormonal disturbances with detached emotionally with indifferent. Alumina disconnects it neurologically. Another remedy is alumina with natrum mur. So alumina confused, slow, disturbed judgment, fear of his own impulses, while natrum is mentally clear, emotionally hurt, silent grief, dwells on past, desire for salt. Alumina has soft stool but cannot expel rectal paresis, while natrum has dry, crumbly stool from dehydration. Natrum suffers emotionally, while alumina malfunctions neurologically. So another remedy which is nearer to the alumina is causticum. Alumina causticum has sympathetic, ideastic, anxiety of other, while alumina is fear of impulses, confusion and slowness. Causticum is progressive paralysis with contracture. Alumina has delayed nerve responses, paresis. So causticum loses power with sensitivity. Alumina loses coordination with dryness. Another remedy is gelsemium, which is also very close to the alumina. So alumina has confusion, disturbed judgment, fear of impulses, while gelsemium is dull, dizzy, drowsy, anticipatory anxiety, fear of approaching in public. In physical level, alumina has delayed nerve conduction, paralytic weakness. Gelsemium has general muscular relaxation, heaviness, trembling, weakness of the single part. Gelsemium is dull from weakness. Alumina is confused due to the delayed nerve action. Another remedy is which is very nearer to the alumina is lycopodium. So alumina is indecisive due to the confusion. Lycopodium is indecisive due to the lack of confidence and fear of failure, desire for sweets. Alumina has constipation with soft stool. Lycopodium has constipation with hard stool and characteristic of 4 to 8 pm aggravation. So lycopodium plans and doubts, alumina thinks and delay. Another remedy, that is phosphorus. Alumina is reserved, fearful, confused. Phosphorus is open, affectionate, sympathetic, fearful when alone, desire for cold drinks. Alumina has dryness of skin and mucous membrane. Phosphorus has burning sensation with thirst for cold things. So phosphorus burns, alumina dries. Another remedy is anacardium. Alumina has disturbed judgment, fear of impulses. Anacardium has conflicts of wills, feels two voices inside. In physical level, alumina has nervous paralysis, delayed sensation, while anacardium has relief of complaints while eating. Anacardium has divided wheels, alumina has delayed wheels. Another remedy is arsenic album with alumina. So arsenic has anxious, restlessness, perfectionist, fear of death, while alumina is timorous, confused and slow. In physical level, aggravation from cold and better by warmth is arsenic, where its opposite, aggravation from warmth and better by cold, is alumina. So arsenic has fear of death, while alumina has fear of losing control. So alumina is delayed, dried and paresis. Its symptoms shows delay without destruction, weakness without inflammation, confusion without insanity is alumina. So as remedial relationship, Dr. Phatak mentions that complementary remedy of alumina is bryonia, where dryness and exhaustion flows in acute state. Related remedy, as we already discussed, is plumbum, silicia and calcarea group. So in potency, I preferably use 30 and 200 potencies for the alumina. So when we think of alumina while prescribing in a short in re, think of alumina as a in short or in 10 lines, or how to remember the core of alumina is slowness at all levels, dryness of skin and mucous membrane, constipation despite of soft stool. Aggravation from warm, better by open air is chilly remedy. Better in evening, fear of own impulses, delayed sensation, nervous exhaustion after walking, after talking or menses. So, alumina patient is slow, dry, weak and disconnected. So, never prescribe alumina without nerve involvement. If nerves are involved, it is probably, if nerves are not involved, it is probably not alumina. So, in alumina, three words: slow, dry and disconnected. When life becomes slow, nerves become weak and dryness replaces vitality, think of alumina. So thank you for patience listening. It is a large episode. So thank you very much. See you in the next episode. Thank you.